Hello everyone. Today I'm going to present the topic glass ionomer cement, under which I'll be covering the contents: introduction, history and evolution, classification, composition, setting reaction of GIC, properties of GIC, indications, contraindications, release property of GIC, manipulation, recent advances in GIC. Definition: a cement is a substance that hardens to act as a base, liner, or filling material or adhesive to bind devices or processes to the tooth structure or to each other. The definition was given in the Phillips. According to McLean and Wilson, in 1994, GIC is a substance that consists of basic glass and an acidic polymer which sets by acid-base reaction between these components. Introduction: GIC was introduced by Wilson and Kent in England in year 1972, and it was introduced in US as aluminosilicate polyacrylate in 1977. GIC was introduced as a potential replacement for silicate cement because of extensive use of this cement as a dentine replacement material, and that's why it is also called as man-made dentine. A greatest advantage of this new cement is that the adhesion to enamel and dentine and the fluoride releasing anti-carcinogenic effect. History: in 1972, GIC was developed by Wilson and Kent, and in 1975, Chris introduced addition of copolymer of acrylic acid and itaconic acid. In 1977, luting GIC was developed by Wilson by reducing the size of powder particles. In 1979, Crisp improved the translucency by adding some new fluoride glasses. In 1980 and 83, Miracle Mix was introduced by Skeld and Wilson and Simmons. Miracle Mix is used for crown and core buildup. The tunnel preparation was introduced by Hunt and Knight in 1984. The tunnel preparation means a technique of preparing a cavity in carious posterior tooth by gaining access to carious lesion on proximal surface from access cavity created on the occlusal surface without involving marginal ridge. In 1984, water hardening glass GIC was introduced by Processor. In 1985, ceramic cement was introduced by McLean and Gasser. In 1985, sandwich technique was also introduced by McLean. In 1989 and 1990, resin modified GIC by Antonucci and Mitra was introduced, and in 1994, atraumatic restorative technique was introduced. Coming to the classification, according to application, GIC is classified under these. Type 1 is luting GIC, type 2 is restorative cement, type 3 is lining cements, type 4 is fissure sealants, type 5 is orthodontic cements, 6 is core buildup cements, 7 is ceramic cement, 8 is for atraumatic restorative technique, and 9 is for pediatric use. According to Skinner's GIC, type 1 is luting, type 2 is restorative, type 3 is liner or base. Here we can see in the first type 2 restorative GIC and in second luting GIC. Composition: usually cement is supplied as powder and a liquid. They are also supplied in a paste form and a capsule form in the case of orthodontic bracket bondings. Powder. Powder contains silica, alumina, aluminum fluoride, calcium fluoride, sodium fluoride, and aluminum phosphate. The composition of glass is an acid soluble calcium aluminosilicate glass, which is formed by fusing silica, alumina, calcium fluoride at 1100 to 1500 degrees Celsius. The glass particles are crushed, milled, and then grounded to a fine powder of up to diameter 20 to 50 micron. The fluoride portion acts as a ceramic flux. Strontium, barium, and zinc oxide provides radio opacity to the powder. Liquid. Liquid contains currently polyacrylic acid in the form of copolymer with itaconic, maleic, and tricarboxylic acid, tartaric acid, and water. Polyacrylic acid copolymerizing with itaconic and maleic acid acts to increase the reactivity of liquid and decreases the viscosity and reduces the tendency to gelation. Tartaric acid acts to control the setting reaction and improves the handling of characteristics. Water acts as a reaction medium and also serves to hydrate the silicosis hydrogel and metal salts formed. Anhydrous cement or water soluble cement that consists of freeze-dried polyacrylic acid and glass powder in one bottle and water with tartaric acid in another bottle as a liquid. Thus, cement has a longer working time and shorter setting time. Setting reaction. When powder, which is containing calcium aluminofluorosilicate, and it is acid soluble and it acts as a base, and when it is mixed with the liquid which is containing polyacrylic acid, a certain chain of reaction occurs within the matrix in different 4 phases. See, here we can see first liquid, which is a acid, and when it is mixed with the powder, so this is acid attack phase, and in this phase various ions are leached out from the powder or glass particles into the aqueous medium, water. So calcium, aluminum, and fluoride ions are leached out. This is called as dissolution form, and these ions forms a polysols together, and they react with the carboxylic acid chains which are present in the liquid. So here we can see carboxyl group that are reacting with the calcium salts and creating a cross-linking in the first phase. So after 24 hours, these calcium ions are replaced by aluminum salts in the cross-linking phase. So after the completion of the third phase, cross-linking phase, the hydration of the entire matrix is called as maturation phase, which forms the formation of matrix gel. So not all the powder particles reacts with the liquid. Some remains unreacted, and they are surrounded by the reacted powder particles with the carboxyl group. So here we can see aluminosilicate glass particles which are surrounded by the silica gel sheath, and they are embedded in the matrix of hydrated calcium and aluminum cross-linked polysols. Here also we can see glass particles are leached in from which calcium, aluminum, and fluoride ions are leached out, and they react with the carboxyl group polychains, and they form a matrix. Role of water is very important. So it plays a double role. First, it helps in the maturation in the to enable the gel structure to remain stable and stronger, and it is the reaction medium of the whole reaction which is occurring. Sensitivity to air, we must protect the cement to before it hardens. It must be protected from the air or water. Exposure of cement to water before hardening reaction is complete, that can lead to loss of cations and anions, which forms a matrix as they can be dissolved. So thus it should be protected. The setting reaction also depends upon several factors. First is glass composition. If the aluminum or silica ratio is higher, faster is the setting reaction and decreases the working time. If powder particles are smaller or finer, fast reaction will occur. If tartaric acid is more added, it sharpens the setting time without shortening the working time. The constituents of cement, greater the proportion of glass and lower the water, faster the set and decreases the working time. Temperature, higher the temperature, faster is the set and decreasing the working time. Properties. Physical properties, it sets rapidly in the mouth. Initial compressive strength is low but increases with time. So after a year, the compressive strength increases. Solubility is low, flexural and shear strength is low. Coefficient of thermal expansion of restoration is close to the tooth. Abrasion resistance. GIC are less resistant to abrasion than composite. Fracture toughness is also less and hardness is also less as compared to composites. Mixing time is 45 to 60 seconds. Working time is 2 to 3 minutes for the traditional cement. Setting time for the type 1 luting GIC is around 4 to 5 minutes and type 2 restorative GIC is around 7 minutes. There is no polymerization shrinkage is seen. GIC sets slowly and develops less interfacial stress. Adhesion, it bonds chemically with the tooth structure by chelation. Bonding is due to reaction between carboxyl group of polyacid and calcium of hydroxyapatite. Bonding of enamel is higher compared to dentine due to greater inorganic content. So the enamel contains higher inorganic contents, that's why bonding is better in enamel than compared to dentine. The principal barrier to adhesion is water. Aesthetics. GIC is a tooth color restorative material that are available in different shades, but it is inferior to composites. They lack translucency and rough surface texture. Potential for discoloration and staining. Biocompatibility, resistance to plaque because of presence of fluoride. Pulp response to GIC is favorable. Freshly mixed acidic pH is 0.9 to 1.6 that can lead to mild inflammation that might resolve in 10 to 20 days. Used to protect mechanical or traumatic exposure of healthy pulp. GIC showed greater inflammatory response than zinc oxide eugenol but less than the zinc phosphate cement and other cements, but it resolves in 30 days. Antichoriogenic property. Type 2 GIC releases fluoride in amount comparable to silicate cements initially and continue to do so over an extended period of time. In addition, due to its adhesive effect, They have the potential for reducing inflammation of oral fluids, infiltration of oral fluids at the cement, but thereby preventing the secondary caries. Advantages of GIC: inherent adhesion to tooth structure, biocompatible because large size polyacrylic and molecules prevents the acid from producing pulpal response. There is little shrinkage and good marginal seal. Antichoriogenic properties available. It is aesthetic because of tooth colored restoration. Minimal tooth preparation is required and hence easy to use on children's. Less soluble than other cements, less technique sensitive than composite resins. Disadvantage is that it has brittle and low fracture resistance, low wear resistance, and water sensitivity during setting phase. Some newer products releases less fluoride than conventional GIC. Opaque, which makes GIC less aesthetic than composites. No inherently radiopaque. Indications: first, restoration of permanent tooth, class 5 and class 3 cavities, abrasion and erosion lesions, root caries. Here we can use the restoration by GIC. For deciduous teeth, class 1 to 5, all the cavities, rampant caries, nursing bottle caries. Third is luting or cementing for the prostheses like metal restorations, inlays, onlays, crowns, veneers, post or pins, orthodontic bands, and brackets. As preventive measures, by using in the pit and fissure sealants and tunnel preparation. Here we can see tunnel preparation is done without involving the marginal ridge in the class 2 caries by preserving the marginal ridge. So this is tunnel preparation. Protective liner under the composite and amalgam. For as a sandwich technique we will be studying in the further slides. Dentine substitutes, that's why it is called as man-made dentine. Core buildups, splinting of periodontally weakened tooth. Other restorative techniques such as sandwich technique, atraumatic restorative treatment. Here we can use GIC. In endodontics also, repair of external root resorption, repair of perforations, and retrograde filling. Coming to contraindications, it cannot be used for class 4 carious lesions or fractured incisors, lesions involving large areas of labial enamel where aesthetic is a major importance. Class 2 carious lesion where conventional cavities are prepared for replacement of existing amalgam restoration, or lost cusp areas because it has less fracture resistance as compared to composites. Now we'll be discussing about fluoride releasing property. It has a karyostatic effect. Fluoride ions released from the restorative material become incorporated in the hydroxyapatite crystals of the adjacent tooth structure to form structure such as fluorapatite that are present in the enamel. Mainly is more resistant to acid mediated discalcification. The fluoride originated from that of used in preparing the aluminosilicate glass, which contains up to 23% fluoride. Thickly mixed cement used for restoration release more fluoride than thinly mixed ones used for luting because they contain proportionately more glasses, then hence more fluoride. Duration of fluoride release. Initial release is high but it declines after 3 months. After this, fluoride release is continuous for a long period of time. Fluoride can also be taken up to the into the cement during the topical fluoride treatment and release again. Thus, GIC acts as a fluoride reservoir. So, hence we can use a fluoride containing toothpaste to release more fluoride from the GIC. Manipulation. GIC is available in powder or liquid, dispensive capsules, clicker dispensers, nozzle types. Manipulation here, first step is preparation of tooth surface. The enamel and dentine are first cleaned after the cavity preparation. First cleaned with the pumice slurry, followed by swabbing of polyacrylic acid for 5 seconds to remove the smear layer, so that the bonding of restoration with the tooth surface will be better. After conditioning and rinsing, tooth surface should be isolated and keep it dry. Proportioning and mixing. Powder and liquid ratio should be 3:1. By weight, powder and liquid is dispensed just prior to the mixing. They are mixed with the use of a gate spatula or plastic spatula, because metal spatula might react with the glass particles of the GIC. And the powder which is taken, it is mixed with the liquid in increment sections. Like first increment is incorporated rapidly to produce a homogeneous milky consistency. Here we can see we have taken the powder, it is divided into the increments. First increments we have used, and to prepare a homogeneous mix, mixing is done in folding method to preserve the gel structure. Finished mix should have a glossy surface. Here we can see both the increments are mixed properly and mixed until it gets glossy consistency. Different type of surface conditioner are used. First is polyacrylic acid. 10% polyacrylic acid for 10 seconds is applied to the tooth structure, that removes smear layer, debris and smoothen out the irregularities. It tends to open up dentinal tubules also. So the conditioner of choice, as it is the part of the cement forming system. Citric acid was used earlier. 50% of citric acid was placed under the prepared tooth surface for 5 seconds. Tannic acid 25% for 30 seconds. Ferric chloride 2% solution that provides metal linkage between collagen and GIC without opening up the dentinal tubules. Here I have already discussed. It is mixed on the paper pad with the use of agate spatula, and powder is mixed with the liquid in increments. Protection of cement during setting. GIC is extremely sensitive to air and water during the setting. Immediately after the placement in the cavity, pre-shaped matrix is applied to it. Finishing is done. Excess material should be removed from the margins. Hand instruments are preferred to rotary tools to avoid ditching. Further finishing is done after 24 hours. Protection of cement after the setting. Before dispensing the patient, restoration is again coated with the protective agent to protect the trimmed areas. Failure to protect for 24 hours result in the vegan cement. Here we can see this is the failed restoration. Crazed surface of GIC is seen, resulted from inadequate protection of material during maturation. It might be contaminated with air or water during the mixing of GIC or placing the restoration into the prepared surface. Coming to the sandwich technique, it was developed by MacLean to combine the beneficial properties of GIC and composite. It was developed. It also known as layering or stratification. Clinical steps. After the cavity preparation is done, the condition of the cavity is developed and good adhesion with the GIC. We will use type 3 GIC, luting, liner or base. Type 3 GIC, which is used as liner or base. Type 3 GIC is placed into the prepared cavity. After the setting of the GIC, the etching is done with the in the enamel of the tooth surface and also on the GIC with the help of orthophosphoric acid for 15 seconds. This will improve the micromechanical bonding to the composite resin with the tooth and restoration. Apply a thin layer of low viscosity enamel bonding agent and finally place the composite resin over the GIC and light cure it. Advantages: polymerization shrinkage is less due to reduced bulk of composite. Favorable pulpal response, chemical bond to the tooth, anti-karyogenic property, better strength, finishing, aesthetics of overlying composite resin. Modified glass ionomers. We'll be discussing about now recent advances. Over the years, GIC has been modified by manufacturer in the order to compensate for some of their deficiency. This has resulted in new products. The modified glass ions are metal modified and resin modified. Metal modified GICs. The main shortcoming of GIC that limits its use in stress bearing area is its lack of fracture toughness. To improve upon its metal reinforced GIC, two types are developed: miracle mixture and ceramic cement mixture. Miracle mixture that contains spherical silver amalgam alloy mixed with the added to the type 2 restorative GIC in the ratio 7:1. It was invented by Seed and Wilson in 1980. McLean and Gasser in 1985 invented ceramic cements. First, we'll be discussing about metal modified GICs. That miracle mix and ceramic mixture. Second is resin modified GICs. These materials are developed to overcome some of the drawbacks of conventional GICs like moisture sensitivity, low initial strength, and fixed working time. Resin modified GICs and second is compomers. Resin modified GICs, a dimethyl methacrylate monomer, hydroxyethyl methacrylate HEMA, is grafted to polyacrylate acid. The presence of unsaturated carbon-carbon bonds enables the covalent cross-linking of the matrix. With the exposure of light, polymerization is initiated along the methacrylate groups. After the polyacrylic acid reacts with the glass particle through acid-base reaction, Fuji 2LC is one commercial preparation of resin modified GIC. Second is fiber reinforced GIC. The incorporation of alumina fibers and other fibers such as glass fibers, silica fibers, carbon fibers, etc. to existing glass fiber at suitable filler or glass ratio was tried mainly to improve flexural strength of the cement. Unfortunately, these composite materials are difficult to mix if sufficient quality of fiber is used to improve a significant increase in the strength. In addition, resistance to abrasion decreases due to lack of bonding between fibers and matrix. Recent advances in GIC are compomers, condensable or self-hardening GIC, flowable GICs, bioactive glass, fiber-reinforced GIC, geomers, amalgamers, hyonomers, chlorhexidine impregnated in GIC, proline containing GIC, CPP, ACP containing GICs, zirconia containing nanobioceramic modified GICs, calcium aluminate GICs. Now coming to compomers, polyacid modified resin composite. Compomers also can be defined as a material that contains both essential components of GIC but at the level of insufficient to promote the acid-base curing reaction in the dark. The compomer is a combination of the word comp for composite and omer for ionomer, that means glass ionomer. Though introduce a type of GIC, it became apparent in the terms of clinical use and performance it is best considered as composite. It has both of the best properties of fluoride releasing capacity of GIC and durability same as composite. Properties: it has a micromechanical bonding between the tooth and the restoration, the adhesion property. Fluoride release is limited. It is significantly less than the type 2 or resin modified GIC. Physical properties: fracture toughness, flexural strength and wear resistance are better than GIC but less than composites. It is indicated in as a Pitton-Fisher sealant. Restoration of primary teeth, class 3 and 5 lesions along with the cervical abrasion and erosions and intermediate restorations. It's also used as basis for composite and liners, small core buildup materials, filling of pit holes and undercuts in the old crown preparations, root surface sealings. Contraindicated in restoration of class 4 lesions, conventional class 2 cavities, lost cusp areas and restoration involving large labial surfaces. This summarizes of the difference between three type of material. Fluoride releasing property is the best in the GICs, then in the resin modified GIC and the least in the compomers. Wear resistance is the best in compomers, then the GIC and then resin modified GIC. Strength is best in compomers, then resin modified GIC and last is GIC. Ease of handling is best in compomers and polishability is also best in compomers. Coming to geomers, this is the true hybridization of GIC and composite, but here pre-reacted GIC powder is dispersed phase within compomer. Combined fluoride release and fluoride recharge of GIC aesthetic and easy polishable. Indications: class 1, 2, 3, 4 and 5 cavities, restoration of cervical erosion and root caries, laminates and core buildups, restoration of the primary teeth, repair of fracture of porcelain and composites. Fuji 7 command set appears pink on setting. Pink shade absorbs light energy and accelerates the settings. Advantages: it is 6 times the fluoride release, antibacterial properties, and the setting time is 4 minutes. And the next is nano ionomers. The latest advancement in the resin modified GIC is nano ionomer, available in commercially since 2007. It is a resin modified glass ionomer in which some nanoparticles such as nanomers and nanoclusters are added to the glass. Like all resin modified GICs, it has aqueous components with a polyacrylic acid and water miscible methacrylate monomers. The addition of nanoparticles improve the polishability and optical characteristic of the cured ionomer. The fluoride release is not compromised. There is presence of significant acid base reaction. Conclusion: many years have passed by the since the uh, GIC was first invented, and it has been popular material from the time it was introduced into the market. Even though the stronger, the more aesthetic material were available, GIC still remained the choice of many practitioners because they satisfy many of the characteristics of ideal cements. These are the references. Thank you.